comment to me on one takeaway that sort of hit home for you in terms of what you're doing today, in terms of what we just heard from Dr. Chernoff. He talked a lot about trends, where things are going. He then specifically talked about, so to speak, how we, those involved in post-acute care, those involved in seniors housing and care, he called it as housing and care providers, how do they play in this shift that he said is not a drift but is a shift? What's a key takeaway? And Ken, I'll start with you.
Sure. Thanks, Bob. I thought Dr. Chernoff's comments were very, very thought-provoking and enlightening and opportunistic for operators and investors in the room here today. One point that he identified that I think really resonates the most with me is this shift from patient-centered care to person-centered care. And I was thinking as he was saying how challenging that is for healthcare operators and for CMS and everyone that's involved in the entire continuum. Why is it so challenging? And I think the answer to the question is because it's hard to scale personalization. You know, it's the idea of scaling patients and data and delivery systems and services and models on a patient, non-personal basis is easier to wrap your head around than scaling mass personalization. And yet, when I was in Katie Fike's session, and she introduced the Aging 2.0 operators that are trying to come up with technological ways to create a more personalized experience for the users of our healthcare system, it hits right on the very same point. How do we make this a more personal experience? So at my company, at Brandywine Senior Living, we're currently in a fairly significant development phase right now. And we are about to open up 3 new communities in the Mid-Atlantic, and we're just started construction on another one, and we're about to start some construction in the Washington, D.C. metro area. And one of the things that we think about in terms of innovation is bringing more of a personalized individual experience to each of the residents that are in our community today. And it is a struggle for us to think about that on a real, visceral basis. The mind, almost like gravity, goes towards this idea of the easiest way to scale, the path of least resistance, and that is to just aggregate and aggregate. So I would say that as part of our commitment to innovate, as part of our exploration of technologies, and as part of our commitment to improve the value model of healthcare, we are focused on this concept of scaling mass personalization.